our search for a cure for the healthcare crisis, we've asked experts to give us their prescription in under 90 seconds.
Well, here's my RX for the healthcare crisis. I focus on 5 points. First, we've got to get the cost of healthcare under control. And one way to do that is by preventing disease in the first place. 30% of the growth in healthcare spending in this country is due to the doubling of obesity in the United States since 1985. Two, we need to do a better job of managing and working with chronically ill patients, people with diabetes and high blood pressure. They account for 75% of healthcare spending. They have high rates of hospital admissions and readmissions, many of which are preventable. The third thing that I would do is focus on administrative costs. Our administrative costs are too high, our system is too complicated. We need to simplify this system so that we can reduce the cost of healthcare and allow physicians and patients to spend more time clinically rather than filing claims forms and dealing with paper. The fourth thing we need to do is provide more information. We know very little, ironically, about what clinical treatments work best and how much they cost. Physicians and patients and families need that information to make more appropriate healthcare choices. And the fifth thing I would do is we have to deal with the 40 million people who don't have health insurance coverage in this country. So we have to find a solution that is bipartisan to cover all Americans. I'm hopeful this time around in the healthcare reform debate that everybody's second choice is not the status quo, but we can really compromise and this time finally cover all Americans.